What does mean inevitable and septic abortion according to nurse midwife? What does mean inevitable table and septic abortion? Septic abortion. Septic abortion. According to nurse midwife. According to La ilaha illallah Muhammadur Rasulullah sallallahu alayhi wa sallam astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায় দেন। Inevitable abortion. Definition: inevitable abortion is a condition in which abortion cannot be prevented because the process of miscarriage has already started and the pregnancy cannot continue. Clinical features: vaginal bleeding, usually moderate to heavy, cramp-like lower abdominal pain, dilatation of the cervix, os is open, rupture of membranes may occur, products of conception remain inside the uterus, either partially or completely. Septic abortion. Definition: septic abortion is an abortion associated with the infection of the uterus and surrounding tissue occurring before, during, or after the abortion process. It is a serious obstetric emergency. Clinical feature: fever and chills, foul smelling, vaginal discharge, lower abdominal pain and tenderness, vaginal bleeding, tachycardia, rapid pulse. Signs of sepsis or septic shock in severe cases. Common causes: unsafe induced abortion, retained products of conception, poor aseptic technique during abortion procedures, untreated genital tract infection. Key point: nurse midwife. Inevitable abortion: cervix is open and abortion cannot be stopped. Septic abortion: abortion complicated by infection requiring urgent treatment with antibiotics and evacuation of retained products if necessary. La ilaha illallah Muhammadur Rasulullah sallallahu alayhi wa sallam astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় পাশ করায় দেন। হাউ উইল ইউ ম্যানেজ a case of septic abortion? Abortion according to nurse midwife. How will you manage? How will you manage a case of septic abortion? A case of septic abortion. Abortion according to nurse midwife. According to nurse midwife. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم استغفر الله ربي من كل ذنب وأتوب إليه হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায় দেন। Management of septic abortion according to nurse midwife. Septic abortion is a serious obstetric emergency requiring prompt treatment to control infection, prevent complication and save the mother's life. Assessment: take history of abortion, vaginal bleeding, fever and foul smelling discharge. Assess vital signs, temperature, pulse, respiration, blood pressure. Evaluate the amount of vaginal bleeding. Assess signs of shock and dehydration. Monitor level of consciousness. Immediate nursing management: admit the patient to hospital immediately, maintain strict aseptic technique, ensure bed rest, establish IV access and start intravenous fluids as prescribed, administer oxygen if needed, collect blood samples of CBC blood grouping cross-matching, and culture obtain high vaginal or cervical swab for culture and sensitivity. Control of infection: administer broad spectrum intravenous antibiotic as prescribed, example ampicillin, gentamicin, and metronidazole. Monitor a response to antibiotic therapy. Observe for signs of spreading infection or septic shock, uterine evacuation after stabilization and initiation of antibiotics, assist with evacuation of written products of conception, MBA, suction evacuation, or curettage as ordered by the physician. Monitoring: monitor vital signs regularly every 15 to 30 minutes if unstable. Measure intake and output. Observe vaginal bleeding and discharge. Monitor laboratory results. Watch for complications such as septic shock, peritonitis, disseminated intravascular coagulation, DIC, renal failure. Psychological support: provide emotional support and reassurance, explain procedures and treatment to the woman and family, maintain privacy and confidentiality. Health education: teach personal hygiene, advise follow-up visits, counsel regarding family planning and contraceptions, educate about seeking safe abortion and antenatal care services. Summary: the management of septic abortion includes hospitalization, assessment, IV fluids, broad spectrum antibiotics, evacuation of written products, close monitoring for shock and complications, psychological support, and health education. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam astaghfirullah rabbi min kulli dhanbin wa atubu ilayh. আয় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল পরীক্ষায় পাশ করায় দেন। Define abruptio placenta. Define abruptio abruptio placenta. Placenta. Write down the difference between concealed and revealed bleeding. Explain the management of abruptio placenta. Explain the management of abruptio placenta. Placenta. According to nurse midwife. According to nurse midwife. Define abruptio placenta. Define abruptio placenta. Placenta. Write down the difference between the difference between concealed and repeat bleeding. Concealed and repeat bleeding. Concealed and repeat bleeding. Explain the management of abruptio placenta. Management of abruptio placenta according to nurse midwife. According to nurse midwife. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায় দেন। Abruptio placenta accidental hemorrhage. Definition: abruptio placenta is the premature separation of a normally implanted placenta from the uterine wall after 20 weeks of pregnancy and before the birth of the baby, resulting in bleeding. Difference between concealed and revealed bleeding in abruptio placenta. Definition: concealed bleeding. Blood collects behind the placenta and remains inside the uterus. Revealed bleeding: blood escapes through the cervix and appears externally. Vaginal bleeding: concealed bleeding absent or slight. Revealed bleeding: obvious vaginal bleeding present. Blood loss: concealed bleeding usually greater than apparent. Revealed bleeding: amount of blood loss can be estimated. Uterine size: concealed bleeding increased due to retained bleeding আর revealed bleeding এর ক্ষেত্রে usually normal or slightly enlarged. Uterine tenderness: concealed bleeding এর ক্ষেত্রে marked tenderness আর revealed bleeding এর ক্ষেত্রে less severe tenderness. Features: maternal shock: concealed bleeding এর ক্ষেত্রে severe, often disproportionate to visible blood loss আর revealed bleeding এর ক্ষেত্রে usually corresponds to visible blood loss. Features: fetal distress or death. কনফ্লিক্ট ব্লিডিং এর ক্ষেত্রে মোর কমন আর রিভিল ব্লিডিং এর ক্ষেত্রে লেস কমন। ডায়াগনোসিস: কনক্রিট ব্লিডিং এর ক্ষেত্রে মোর ডিফিকাল্ট আর রিভিল ব্লিডিং এর ক্ষেত্রে ইজিয়ার ডিউ টু ভিজিবল ব্লিডিং। Okay, management of abruptio placenta according to nurse midwife. Immediate assessment তা হচ্ছে assess airway, breathing and circulation, check maternal vital signs, pulse, blood pressure, respiration, temperature, assess amount and type of vaginal bleeding, monitor fetal heart rate, evaluate uterine contraction and tenderness. Emergency measures: admit the patient to hospital immediately, place the woman in left lateral position, maintain bed rest, administer oxygen 6 to 8 liter per minute. If required, establish IV access with a large bore cannula. Fluid and blood replacement: start IV fluids, normal saline or Regner's lactate. Collect blood for hemoglobin estimation, blood grouping and cross-matching, coagulation profile, arrange blood transfusion if necessary. Continuous monitoring: monitor maternal vital signs every 15 to 30 minutes, fetal heart rate, urine output, insert folic acid if indicated. Signs of shock and disseminated intravascular coagulation (DIC). Obstetric management: inform the obstetrician immediately. If labor is progressing and mother or fetus are stable, vaginal delivery may be allowed. If severe hemorrhage, fetal distress, or maternal condition deteriorates, prepare for emergency cesarean section. Psychological support, reassure the woman and family, explain procedures and treatment, provide emotional support, postpartum care, observe for postpartum hemorrhage, continue monitoring vital signs and urine output, assess for anemia and complication, ensure adequate nutrition and rest. Key signs of abruptio placenta: painful vaginal bleeding, sudden abdominal pain, tender, rigid, board-like uterus, uterine contraction, fetal distress or absent, fetal heart sounds, maternal shock. Nurse midwife examination point: abruptio placenta is the premature separation of a normally situated placenta characterized by painful bleeding, uterine tenderness, and fetal distress. Management focuses on stabilization of the mother, monitoring the fetus, controlling hemorrhage, and timely delivery. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. Astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় পাশ করায় দিন। বলছে কি, what does hyperemesis gravidarum what does what does hyperemesis hyperemesis emesis gravidarum means mention the significance of it significance of it as a nurse. How will you manage a patient such condition? Patient such condition. According to nurse midwife, what does hyperemesis gravidarum means? What does hyperemesis hyperemesis gravidarum means? Mention the significance significance of it as a nurse? How will you manage a patient such condition? A patient such condition according to nurse midwife. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam astaghfirullah rabbi min kulli dhanbi wa atubu ilayh। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায় দেন। হাইপারেমেসিস গ্রাভিডেরাম definition: hyperemesis gravidarum is a severe form of nausea and vomiting during pregnancy that is excessive and persistent, leading to dehydration, weight loss, electrolyte imbalance, ketosis, and nutritional deficiency. Significance of hyperemesis gravidarum: causes severe dehydration, leads to electrolyte imbalance, hypokalemia, hyponatremia, causes weight loss and malnutrition, may result in ketonuria due to starvation, produce weakness, fatigue, and dizziness, can lead to metabolic disturbances, affects maternal physical and psychological well-being, may impair fetal growth if prolonged and untreated. In severe cases, may cause liver and renal dysfunction, increases the need for hospitalization and intensive care. Nursing management of hyperemesis gravidarum according to nurse midwife. Assessment: assess severity of nausea and vomiting, monitor vital signs, pulse, blood pressure, temperature, respiration, check for signs of dehydration, dry tongue, poor skin, turgor, measure daily weight, monitor intake and output, test urine for ketones and specific gravity, fluid and electrolyte management, maintain IV fluid therapy as prescribed, normal saline, dextrose, ringers, lactate, monitor electrolyte levels, record fluid balance accurately. Nutritional management: keep the patient NPO initially. If vomiting is severe, gradually introduce small frequent meals. Encourage dry foods, toast, biscuits, crackers. Avoid spicy, fatty, and strong smelling foods. Encourage adequate fluid intake between meals. Medication administration: administer antiemetic drugs as prescribed, give vitamin supplements, especially vitamin B6 and other prenatal vitamins, administer medication safely and observe for side effects. Comfort measure: provide a quiet, well ventilated environment, encourage adequate rest and sleep, reduce exposure to odors that triggers nausea, maintain oral hygiene after vomiting, psychological support, reassure the woman and family, reduce anxiety and emotional stress, provide health education regarding the condition and treatment, monitor for complications, observe for dehydration, electrolyte imbalance, and malnutrition, monitor maternal and fetal condition regularly, report worsening symptoms immediately. Conclusion: hyperemesis gravidarum is a serious pregnancy complication characterized by persistent and excessive vomiting. Prompt nursing assessment, fluid replacement, nutritional support, medication administration, and psychological care are essential to prevent maternal and fetal complications. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি। হে আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হে আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় পাশ করায় দেন। মিস্টার এক্স history of history of 36 weeks gestation, Mrs. X देखो X gestation but P/A/E height of uterus height of the uterus is 33 weeks and less FM and less FM. What is your possible diagnosis? What is your possible diagnosis and causes of this disparity and causes of this disparity? How will you manage this patient depending on the situation? Patient depending on the situation. MRS mistress X history of 36 weeks gestation but P slash height of the uterus is height of the uterus is 33 weeks and less FM and less FM. How will you what is your possible diagnosis? What is your possible diagnosis? আসসালামু আলাইকুম জুতা খুলে আসেন ভিতরে আসসালামু আলাইকুম ওয়ালাইকুম আসসালাম আসেন জুতা খুলে আসেন ভিতরে বসেন জি বসেন একটু আগে আলাপ করলে বলবো ভিজিবিলিটি কত এটার সার্চ কত আবার ম্যাডাম পাঠাইছে এবং